The restaurants, what we're going to do is allow outdoor seating with social distancing, so you need to have at least 6 feet apart from the tables. And then indoors, they can do 25% capacity with the CDC recommended spacing.
That's Florida Governor Ron DeSantis just minutes ago saying that Florida can get started on reopening for business. That will start Monday across most of the state, leaving out South Florida for now. And there are some limitations. Bars, gyms, and some other businesses will remain closed for now. The governor says the state has successfully flattened that curve and can enter into phase 1 of the process to get past the coronavirus. And I want to point out, too, we just got this statement from Jacksonville Mayor Lenny Curry on his reaction to what Governor DeSantis just said. And he says, in part, the plan lays out an approach that is safe, smart, and ready to guide us here on the First Coast step by step back to the life we knew it before the virus. This plan, working in conjunction with national guidance from President Trump, will allow our city and every community in Florida to get back to life as we knew it just months ago. On your side's Troy Kless is looking more closely at what's going to come next for our lives.
The beginning and end of April, marked by the closing and the signs of reopening of non-essential businesses in Florida. If you remember, on April 1st, Governor Ron DeSantis issued a safer at home order for 30 days. The governor sat down with President Donald Trump to discuss his plans for reopening the state. Here's the takeaways from Ron DeSantis' press conference. A new phase for Florida begins Monday, May 4th. Restaurants and retail stores can be open with 25% capacity. Governor DeSantis says phase 1 will not include opening bars and gyms. The governor also said COVID-19 testing will be expanded. One doctor thinks the First Coast has done well to flatten the curve. Dr. Sunil Joshi is the president of the Duval County Medical Society Foundation. He says that he believes a slow, thought-out approach to opening the state back up can work, but he says that social distancing guidelines must remain in place for it to be effective.
If you open in phases and you slowly pay attention to what's happening and looking at the numbers over time, still making sure that we're testing as many people as possible, if all of those things continue to be favorable after an extended phase-in period, then you can add another phase.
Dr. Joshi thinks that practices like wearing masks in public and washing hands and using hand sanitizer should remain in place for the weeks and months ahead. Troy Kless, First Coast News, on your side.